In a matter of months, the Make America Healthy Again movement is transforming U.S. health agencies. Once Democratic royalty, RFK Jr. dropped out of the 2024 presidential race and endorsed Donald Trump, ultimately becoming his health secretary.
I normally buy these eggs.
For voters like Bernadine Francis, a lifelong Democrat, it all came down to one issue: MAHA.
Do you think that's why so many people just like you ended up voting for President Trump for the first time? Just because of this one issue?
Yes.
And turn a blind eye to maybe the other things you don't like?
Nothing else mattered.
Make America Healthy Again hat
is Make America Healthy thing.
It's not our movement. It's a movement of the American people, of moms and dads who have said something's not right.
Many Americans questioning the public health system. For example, just over half say they trust the FDA. The question is how much skepticism is driven by real problems in the system versus the elevation of figures like RFK Jr., who has a history of spreading misinformation. Inside the FDA, in some ways, it's business as usual.
And here, researchers are developing test methods for medical devices that millions of Americans could end up using.
But RFK Jr.'s hand-picked FDA commissioner, a Johns Hopkins surgeon, wants to reshape the agency's mission.
I don't think the surge of chronic diseases in our lifetime is a genetic or willpower problem. This is something that adults are doing to children. We are feeding ultra-processed foods loaded with chemicals that are banned in Europe. We don't even understand some of these things.
He points to nutrition guidance as an example of misinformation pushed by the government.
Are you saying that the public health system in America has essentially been bought by big pharma and food industries?
There's been corruption, for sure. I mean, you look at the food pyramid, it was not based on what's best for you. It was based on what companies wanted you to buy.
Is there going to be a new food pyramid?
There's going to be an entirely new nutrition guidance.
MAHA hasn't gone without controversy.
The MAHA Commission report sets the agenda.
That 75-page report, focused on ultra-processed foods and environmental toxins, cited some studies that didn't exist, since corrected, and left out leading causes of death for children like gun violence. Then, a back and forth on the COVID vaccine. Research shows the side effects are less dangerous than getting the virus itself. The administration first telling Americans the shot is no longer recommended for healthy children and pregnant women. Critics sounded the alarm.
It doesn't make sense. I think it puts children unnecessarily in harm's way.
Then, days later, the guidance updated, urging parents to consult with their doctors instead.
Is it just trading one public distrust or one form of public distrust for another?
Yeah, my experience with Secretary Robert F. Kennedy is that he listens. The questions he's asking are the questions most Americans are asking.
COVID, clearly a turning point for voters like Francis, a former public school administrator who voted for President Biden in 2020.
I think that was when the big change became in terms of my political affiliation.
You had to get vaccinated or you would lose your job.
Yes.
She says she isn't anti-vax, and it isn't just about the vaccines.
I have 4 daughters, and health have always been very important to my family. They didn't do a lot of junk, didn't eat a lot of sweets.
Dr. Dawn Musalim is not part of the MAHA movement, but also believes some core MAHA ideas, like exercise and eating minimally processed foods, can have a profound impact. She's an oncologist with her own incredible story of survival.
We have to trust the conventional medicine.
Through medical treatments, she survived stage 4 cancer and, after heart failure, received a life-saving transplant. Then ran a marathon 1 year later.
How has that experience changed the way you practice medicine? It's changed it so much, Julie. You know, I learned a lot in medical school, but nothing compared to what I learned being a patient.
She says medical misinformation is a real problem. Her purpose now to elevate modern medicine and a healthy lifestyle.
Patients come in with all these questions, fears. They're terrified of what they eat because there's so much influence by non-medical experts.
Influence online and now in government, as doctors like Dawn try to help her patients make sense of it all. Julie Sirkin, NBC News.